My name is Tom Lenz. I'm a professor in the School of Medicine at Creighton University and the director of the Integrative Health and Wellness program. The purpose of this video is to give you a little bit of overview of the Integrative Health and Wellness master's degree by way of talking a little bit about the history of the program and mostly spending some time on the curriculum and what the outcomes are for a program like this. So the program started in 2015 at the request of the then university president, Father Lenz. We had a large focus on health and wellness, particularly developing new didactic programs in the undergrad and the graduate level, and then complementing that with doing community work in the area of health and wellness. The program was based off of an already existing program for Creighton employees. At the time, it was called the Cardiovascular and Diabetes Risk Reduction Program, where employees would meet with lifestyle medicine specialists at least once a month and managing their lifestyle behaviors in the context of whole person health. That provided a basis for our program, the master's degree in integrative health and wellness, and from there it expanded, and we currently are in the Department of Family and Community Medicine, which is a fantastic fit for us in integrative health and wellness because it matches so well for the objectives of the program. So integrative health and wellness is, in the broadest context, integrative care, which is really looking at combining conventional medicine with complementary medicine. And that's how we look at it at Creighton, particularly in the Jesuit tradition, focusing on whole person health. And so what that means to us is we work with folks, we train our students to work with folks who have chronic disease and are being managed in a conventional medicine setting with most likely taking medication, receiving treatment from our healthcare system in the most conventional way, and then adding on complementary modalities such as proper nutrition, exercise, stress management, and then adding in even more layers of spiritual health, community health, family health, relational health. And this is how we see the context of an individual who has many interrelated but complex factors that all come together to make up what health means for that individual. So for us at Creighton, in Integrative Health and Wellness, we offer a master's program that is 36 credit hours. As a breakdown of those credit hours, just to help you understand that a little bit more, the curriculum is comprised of 9 core courses that are 3 credits each. So that makes up 27 of the 36 total credits. And then from there, the student has several options on what to do with the 9 remaining credits, or basically 3 courses. So we have several elective courses that students can take to fill out the rest of those 9 credits. And we partner with other programs at Creighton, other master's programs at Creighton. So they don't all necessarily need to be within the Integrative Health and Wellness program, but they could be in the public health program, the healthcare ethics program, the leadership program, so forth. Many students also choose to use those electives for one of 2 or perhaps both concentrations that we offer. So we offer a concentration in health and wellness coaching. It is a program that's credentialed with the National Board for Health and Wellness Coaching for students who would like to become a certified health and wellness coach. And in that particular program, we have 1 course that is required for that concentration, then 2 elective courses. That one particular course that is required for the health and wellness coaching concentration is a hybrid course. It's the only course in our program that is hybrid, meaning that part of it is online and part of it is in person. So students who choose to take the coaching concentration come to Creighton campus in Omaha at one point during their studies. And the time that they're in Omaha is generally about 3 to 4 days. The other concentration we have is in healthy aging. Students who choose that concentration take a course called Healthy Aging, and then the focus of that concentration is to get experiential practice working with individuals who are advanced age. And that can be in many different settings, and we customize that experience, that experiential piece of that with each particular student, depending on where they live and what they have access to, what they're allowed to do and able to do to get those experiences. But it's an accumulation of 128 hours over the time that the student spends at Creighton. And those hours can be started as soon as the student enrolls. And so we work on an individual basis with students who are interested in healthy aging. And we also have the option of combining those two concentrations, and it is possible to get all of that still completed within the 36 hours. So we have some students who choose to do both health and wellness coaching and healthy aging for the purpose of specializing in integrative health and wellness coaching advanced age individuals. And that's a very unique opportunity for the students who choose that option. And for those who do, it takes a bit of work with the individual students to make sure that their course schedule is lined up to be able to complete all that within the time frame that makes sense for them. Most of our students finish the program within 2 to 2.5 years. Some much faster, within a year, and others take a little bit more time. It depends on the student, and certainly we work with students at all in all points along the way to make sure that their plan of course schedule meets their needs. There are a couple other caveats to the curriculum that we feel like are really important to highlight and of interest to individuals too, and that we have two what are called graduate certificates that are embedded within our curriculum. One of those is lifestyle medicine. Lifestyle medicine is the use of lifestyle behaviors to prevent, manage, and sometimes even reverse chronic disease. And those lifestyle behaviors most commonly would be nutrition, exercise, sleep, stress management, substance use mitigation, and certainly behavior modification. And that particular graduate certificate is embedded within the core courses of the Integrative Health and Wellness program. So more specifically, graduate certificate programs are 15 credits, so it's nearly halfway to the full master's. So there are 5 courses for the graduate certificate in lifestyle medicine that students complete, and it's typically the first 5 courses in the program. And as I said earlier, we have 9 core courses. The lifestyle medicine graduate certificate makes up 5 of those 9 courses. So students who apply to the Integrative Health and Wellness Master's program will by default earn the graduate certificate in lifestyle medicine as well. Some students enroll into the graduate certificate program only, and then once they complete those 5 courses, some of them finish their education at Creighton. Others continue on in the Integrative Health and Wellness Full Master's program. There is a second graduate certificate program that we have, and we partner with our Masters of Science in Organizational Leadership program to offer that certificate, and it is in leadership and well-being. Two of the 5 courses, again, it's 15 credits, 2 of the 5 courses come from the leadership program, and then 3 of the 5 come from the Integrative Health and Wellness program. It's a very unique and wonderful program because it combines students from both programs, and students have an opportunity to learn from each other in that regard. So from an overall perspective, that is how the curriculum works. We work with each student individually to design their plan of study so that it matches their personal needs of being a student, having a job and a family, and other relationships that are important to continue to have balance with as they spend their time at Creighton being a student. One of the things I think is important to mention is that fundamentally we are rooted in a couple very important principles that we build all of our foundation on relative to the philosophy of the program, the courses, and in our interactions with the students and in the community. One of those is something we call relational care. It is something we feel very strongly about, is that everything is built upon our relational exchange that we have with others relative to our health. And so we embed that within each of the courses, and it's in our philosophy overall that when we're working with other people on a professional, in a professional nature, that this really is a relationship, and it's a relationship that we both give and receive. And so that's why we call it a relational exchange. But essentially, we are helping our students to learn what relational care means. And this is as opposed to transactional care that historically a lot of our healthcare system has progressed in that way of just seeing health as more of a transaction. We look at it more of a relationship, and hopefully it's a long-term relationship. The other piece that's really important for our foundation is that we focus a great deal on the structure of our environment, and particularly the social structure. So we have a lot of emphasis on the factors that determine an individual's health that are socially related. So we look a lot at social justice issues. So for example, when you're looking at nutrition, that it is looking at an individual's access to food as being one example of a social determinant of health. But there are many other factors, of course, in the complexity of an individual's life. And so that's something that within each course and each topic we have embedded there, so that we have a focus that when we work with an individual in a relational way, that we understand the fullness of the individual, so that perhaps the barriers that are there to, say, for instance, taking medication as they're prescribed, or eating in a way that would be helpful for their chronic condition, or getting more exercise, or being able to sleep, that there's a story to that with each individual. And so this is the combination of that relational care and the social determinants of health that are our guiding principles for offering this program. So if you're interested in the program, or if you are already in the program, I would love to meet and talk further about this. If you have questions, our faculty are always available to help in any way that we can, to help make a plan for you that works for your career goals, for your personal goals. So thank you for watching. I look forward to hearing from you soon.